Hello everyone, good evening. Today we are going to talk about the plasma protein. So this is too much important topic. So at the end of the class, we will be able to define plasma proteins, functions of plasma proteins, classifications of plasma proteins, normal range and their clinical significance. So we'll talk on these objectives. As you all know that plasma in the blood there are 55% and remaining 45% is blood cells. Once you in anticoagulated blood after centrifugations, we can separate the plasma. In plasma, the main components, main molecules, protein molecules, which is present, and that protein molecules which is present on the plasma, that is called plasma proteins. And these are the important plasma proteins: albumin, globulin, and fibrinogen. So major one is albumin. So these three are plasma proteins. Let's talk about the albumin. So albumin, the major constituent, about 60% of plasma proteins, whereas molecular weight is 69,000 Dalton. And the albumin, which is going to synthesized by the liver, 12 gram per day. So liver is able to synthesize 12 gram albumin per day. If I'll talk about the functions of albumin, there are four major functions. One is albumin is going to maintain the colloidal osmotic pressure. As you all know that plasma protein is a colloidal substances, and the major albumin is, whereas buffering action, so it has maximum buffering capacity and transport functions. So albumin is going to able to transport free fatty acids, bilirubin. So bilirubin is going to transport into the liver by the albumin. Steroid hormones, drugs, calcium, copper, minerals, many more things. They are going to transport with the help of albumin. If I'll talk about the nutritive functions, albumin contains all the essential amino acids. So that's what they have an important role, nutritional role, and due to the presence of all the essential amino acids, and which play a vital role for the growth and development of our body. So coming to the globulin, it constitutes several proteins that are separated into four distinct bands. That is nothing but the alpha 1, alpha 2, beta, and gamma globulins. And they perform variety of functions, which includes immunity and transport. Whereas fibrinogen, it is soluble glycoproteins that constitute only 2 to 3% of plasma proteins, whereas albumin is almost 36 to 37%. So it having a role in blood clotting mechanism. So if I'll talk about the normal range of plasma proteins, so total protein having 6 to 8 gram per deciliter, whereas albumin 3.5 to 5 gram per deciliter, whereas globulin 2.5 to 3.5 gram per deciliter. Fibrinogen, this is quite major amount, that is nothing but the 0.2 to 0.4 gram per deciliter. So if I'll talk about the AG ratio, albumin globulin ratio, it is 1.2 is to 1 to 1.5 is to 1. So this is the normal range of plasma proteins. Coming to the normal pattern, in agar gel electrophoresis, normal serum is going to separate it into 5 distinct bands. And their normal relative concentration is albumin having 55 to 65%, alpha 1 globulin having only 2 to 4%, whereas alpha to globulin having 6 to 12%, beta globulin having 8 to 12%, gamma globulin having 12 to 22%. Coming to the significance, clinical significance of plasma protein. So this is going to play an important role in uh, clinical aspects and some clinical conditions. With the help of electrophoretic technique, as you all know that electrophoresis is a analytical technique in the presence of electricity, and then molecules get separated. Through that, we are going to separate the plasma proteins through the electrophoretic technique, and the electrogram, that is the electrophoretic pattern, and we are going to uh, compare with the normal one. So in the case of chronic infections, gamma globin have going to increased band of gamma globin. But whereas multiple myeloma, there is a spike like a M band. So in multiple myeloma, you will get M band. And fibrinogen, through this, there is a prominent band in the gamma region. Whereas primary immune deficiency, gamma globulin fraction is going to reduced. In the case of nephrotic syndrome, there is alpha 2 fractions that is going to, there will be a very prominent alpha 2 fractions. In the cirrhosis of liver, as you all know that albumin is going to synthesize by the liver, so albumin is going to decrease. So albumin band will be the thin. Chronic lymphatic leukemia, gamma globulin fractions is going to reduce, whereas alpha 1 antitrypsin deficiency, so alpha 1 band will be the thin. You can see this is the normal pattern. This is the normal pattern, and this is the inflammatory pattern of electrogram, and this one is multiple myeloma. So just here, this is the M-like a structure, so you can call it as a M band. So in summary, the total plasma protein content is 6 to 8 grams per deciliter, of which albumin is 3.5 to 5.5 grams per deciliter, and the rest is globulin. Almost all the plasma proteins are synthesized in the liver except immunoglobulins. Albumin contributes to colloid osmotic pressure of plasma, has buffering capacity, and transport medium for the various hydrophobic substances. So on the agarogel electrophoresis, albumin has maximum mobility, while gamma globin has minimum mobility. Hypergamma globinemia is seen in conditions of hypoalbuminemia, chronic infections, paraproteinemia. And this is the important questions you'll get in your examinations. Define plasma proteins, write in brief about the types, functions in normal range, and clinical significance of plasma proteins. So this is the quotation for you. Thank you. This is all for today.